Hello, my name is Trina Gangoli, and the date today is February 22nd, 2023, and this is part 2 of my Diseases of the Cell final project presentation. So now I'll be getting into the genetics of Gaucher disease. Gaucher disease is not influenced by epigenetic factors. It is passed along in an inheritance pattern called autosomal recessive. Autosomal recessive patterns manifest by skipping generations, as the affected are usually children of unaffected carriers. It is also common to see affected individuals with unaffected offspring. Both parents must be carriers of a Gaucher mutated gene for their children to be able to inherit the condition. This means that each parent must pass along the recessive abnormal GBA gene for their child to get for them to get the disease and display the symptoms. Since Gaucher disease is an inherited disease, if both parents are carriers of the mutated GBA gene, then their child will inherit the condition, but may not necessarily have the disease or show the symptoms. And if both parents have Gaucher disease, then and show the symptoms, then all of their children will inherit two Gaucher disease genes, and will also have the disease and the symptoms as well. And so this image is a pretty good breakdown of the genetic distribution of the gene. And so from the top left corner, it starts with the one parent being the carrier, the other being unaffected. This would cause the offspring to be half of them to be carriers and the other half to be unaffected. If in the situation where one parent has the disease and the other parent is unaffected, then all the children are born as carriers. If both parents are carriers of the gene, then their offspring will be a mix of having the disease, being carriers, and being unaffected. And if one parent is a carrier and one parent has the disorder, then it will be a mix of the offspring having the disease and being carriers. And next we will go into the trends in current research and treatment. Unfortunately, there is no way to prevent Gaucher disease if you have the gene mutations. Also, there is no cure for this disease. However, there are some treatment options that are available, such as genetic therapy. However, genetic therapy is an area where further research needs to be done. Successful gene therapy could provide a one-time long-term treatment or potential cure of a genetic disorder. And so the situation for Gaucher disease, the treatment using genetic therapy would provide some cells with a healthy copy of the GBA gene. And some other common treatment methods that are available at the moment are enzyme replacement therapy, or ERT, which balances low levels of GCase enzyme with a modified version of the normal human enzyme. And this allows your body to break down glucocerebroside, which is a fatty chemical that builds up in your organs and bone marrow. And so patients would receive ERT through intravenous infusion, or IV, about every 2 weeks, either at an infusion center or at home. Enzyme replacement therapy involves intravenous infusions to correct the underlying enzyme deficiency that causes the symptoms of Gaucher disease. In particular, common use of ERT is for lysosomal storage diseases in specific. There is also substrate reduction therapy, which is also known as SRT, and this works differently from ERT. And so instead of restoring low levels of GCase enzyme, SRT would reduce the amount of glucocerebroside produced within the body. This process then decreases the work the body's enzyme must do by giving it less glucocerebroside to break down. SRTs are normally given through oral medication, whereas ERTs are through IV. And so as a result, active research is being done on this topic, specifically on different types of preventative therapy and treatment methods for this disease, along with a potential cure. Also, in terms of managing this disease, for both children and adults with Gaucher disease, it has been advised that they should eat a healthy diet with foods that are rich in vitamin D and calcium to help keep their bones strong and get regular exercise, since this disease is known to weaken the bones. Vitamin D, calcium, or some other supplements may also help to ease the symptoms of Gaucher disease. And also, when it comes to long-term care, most symptomatic patients with this disease usually receive enzyme replacement therapy, or ERT, which is provided on an outpatient basis. However, they also receive medications such as teleglucarase or miglustat, which is also known as Savesca, about every 6 months. And so the image here is a short little flowchart of different types of treatment methods and how to choose the different kinds of treatment methods that are available. And so now I'll get into the conclusion. So overall, Gaucher disease is a rare autosomal recessive genetic disease which is known to increase your risk of developing osteoporosis, Parkinson's disease, and other certain types of cancer. Most patients do not develop Parkinson's disease or cancers related to Gaucher disease, and treatment can decrease the risk of osteoporosis. It can also lead to blood disorders. This disease can also lead to blood disorders such as anemia and bone disorders, since the disease interferes with the blood supply and the blood supply to the bones, causing the bones to weaken, or fracture, or even die in some situations. And although there is currently no cure for Gaucher disease, the subject area is something that is being heavily studied to figure out future treatment directions. Future studies should also look more into what is causing these mutations to occur, along with the pathophysiology of this disease. And at the moment, there are also many research studies going on in the process, studying why this disease affects patients differently. However, everything regarding the future studies and the treatment and the cure is in the trial phase at the moment, and is being studied for future directions. And here are my references for my presentation. Thank you.